Unfortunately, I might need to start from the beginning again. So once again, I welcome us to this lecture today because we need to record it for the benefit of those who are not here so that they can listen to this lecture later. So like I said, our topic today is going to be blood and its components. And blood and problems coming up from blood is going to be one of the commonest problems or challenges that you're going to see patients face in the hospitals. So what is blood? Blood can be said to be a connective tissue. And the estimated volume of blood in the male population seems to be higher than that of the female population. For the males, the volume of blood is about 5 to 6 liters. And for the females, the volume of blood is about 4 to 5 liters. Then, when you talk about the pH of blood, is slightly alkaline, that's slightly above 7. I already said that from 7 and below, from 1 to 7 is acidic. Anything above 7 is alkaline. So the pH of blood is found to be about 7.4 pH, which is alkaline. And the color of blood, everybody knows that blood is red, but the color ranges from bright red to dark red. And whether the blood is bright red or dark red, what determines it is where that blood is at that particular point in time. If the blood is in the arteries, they tend to be bright red because they have more oxygen than the blood found in the veins. And the functions of blood, there are 3 major functions of blood: transportation, regulation, and protection. And when you talk about transportation, the function of blood as regards transportation, you can, when you look at the respiratory system, blood helps to transport oxygen and the red blood cells from the lungs to other parts of the body. And blood also transports carbon dioxide from the lungs, from other parts of the body to the lungs. You know, there is gaseous exchange in the lungs. So the blood transported from other parts of the body to the lungs. When you breathe in the air, the oxygen that you are breathing in is exchanged in the lungs. So the blood now picks up this oxygen and delivers it to other parts of the body, to the brain, the muscles, the organs, and the tissues. And then as it is delivering this oxygen to these places, then it's also collecting carbon dioxide, which is a waste product, from these other parts of the body, from the tissues, from the organs. The blood is collecting the carbon dioxide back to the lungs for excretion, so that as you're breathing in, the blood is picking up the oxygen in the air you're breathing in. And as you're breathing out, the blood is giving away the carbon dioxide that is toxic to your system. So that is the transportation aspect or function of blood. It is moving oxygen from the lungs to the other parts of the body, and then taking carbon dioxide from the other parts of the body away from the body through the lungs. Then the nutritive function of blood is that it is in the blood that nutrients are absorbed. When you eat and the food you have eaten is digested in the digestive system, these digestive organs, the intestines, the different parts of the intestines, the stomach, and the rest of them, they are highly vascularized. They are supplied blood, and the blood supplied to these places now collects the nutrients from the digestive system and distribute them to other parts of the body. That is why, for instance, if somebody is hungry, the person might start feeling dizzy, hypoglycemia. That dizziness might show that the brain is not getting enough glucose, it's not getting enough nutrients. That is why the person might start feeling dizzy. It is now the blood that is going to get to the stomach and to the intestines to collect nutrients. Assuming you're hungry, you're feeling dizzy, you're feeling weak, that means your body needs these nutrients from food. Then, because your brain has been sent this signal, you go to get some food. You sit down, relax, and start eating. Once you start eating that food, digestion even starts from the mouth down to the stomach, down to the intestine. As you're eating and digesting this food, your blood is picking the nutrients to the different parts of your body. That is why when you're feeling dizzy because you are hungry, if you eat, it is the blood that now collects the nutrients, transports the nutrients from the digestive system to the areas of your body that need them. That is why if you're feeling dizzy and your brain now starts getting the nutrients delivered to it through blood, through transportation of blood. If your brain now starts receiving the nutrients, you stop feeling dizzy. If you were very weak, your muscles needed the nutrients so badly. If you start eating, it is the blood that now transports the nutrients to the tissues, your muscles and your tissues, and you start getting strength. That is why sometimes some people have fainting episodes because they are hungry, because they're hypoglycemic. But once you give them something to eat, they come up. That means the blood has transported the nutrients they need from the digestive system to the different parts of the body that needed the nutrients at that point in time, and the person will feel all right. So under the same transportation, as part of the work blood does in your system, it helps to excrete metabolic waste. Anything that our body doesn't need, it collects it. Blood helps to collect all this waste to the particular parts of the body that needs to excrete it at that point in time. Do we get it? So the excretory function of blood is when the blood transports the waste materials to the organs like the kidneys and even the liver and the intestine, takes all the things that we don't need, our body doesn't need. The excess water will go to the kidneys and be excreted as urine. So it is the blood that helps to transport these waste products to the organs that will now take them off our system. So under the regulation, kindly hang on, I need to take care of something. We can proceed. So another function of blood is that it helps in regulation. The first function under the regulation is the hormonal regulation of our body system. So the blood helps to carry hormones from where the hormones originate, where they are formed, to the target tissues. So some hormones are produced, let's say, in the kidneys, and this hormone may be needed in the brain. So they cannot just migrate on their own. It is the blood in our system that carries these hormones to the target tissues or the target organs to help the body to function well. Then also temperature. The blood helps to regulate our temperature. It is the temperature that is responsible, it is the blood that is responsible for carrying heat to different parts of our body. That is why sometimes if you feel cold, assuming you put your hand in a very cold water, your body will give a signal to other parts of the body that, see, oh, this hand is colder than other parts of the body. What are we going to do? Now, let's take some heat to the hand so that the temperature will come up. So the body is going to transport heat from other parts of the body to your hand to heat up your hand so that it doesn't continue getting cold. That is why if you dip your hand in cold water, after some time, you don't even need to do much. The temperature of your hand will increase and get back to normal. It is the function of your blood to move temperature, to balance the temperature of your body. Also, if you're feeling cold, assuming you go out of the house and the weather is cold, the surface of your body will feel colder than the inside. So it is now the blood in your system that will push heat from the inner part of your body outside to regulate your blood. So that is one of the functions of blood. Another function of blood is that it helps in protection. The first thing is clotting. When we injure ourselves, we tend to bleed. And if that bleeding continues, our body system will be at stake. We might lose a lot of blood. So now it is the same blood that helps to stop the bleeding by introducing some clotting mechanisms to help to stop blood loss at that point in time. So as our blood is doing this, helping to stop bleeding by clotting, it is helping to protect our body system. And the next function of blood is immunity. It is in the blood that you find some blood components that help us to fight infection. That is why sometimes you'll be down with, let's say, cold, you'll be down with flu, and you did not take any medication, you did not do anything. After some time, you see yourself recovered from that condition. It is the components of your blood that their major function is to protect your system. So those are the things that help you to fight infection and to help you with to fight diseases and infections. And we're going to talk about that later. So if you can look at the screen now, this is just the composition of blood. The blood in our system, what and what can be found, or what and what make up the blood. You know, the greater part of the blood is the plasma, is yellowish. Then you see the red blood cells, and it is the red blood cells that give the blood in our system that color, that's red color. Then you also see the white blood cells. The white blood cells are, what they do is to help us to fight infection. And then the platelets help to, helps to clot blood, especially when we are bleeding, so that we don't bleed more than we should. So these are the 4 components of blood, and each of them have their own, what they do, their own functions. So now looking at the next screen, the blood in our system is majorly divided into 2, the plasma and the cellular elements. And when you talk about the cellular elements, you're talking about the red blood cells, the white blood cells, and the platelets. The red blood cells are also called the erythrocytes. The white blood cells are also known as the leukocytes, and the platelets are known as the thrombocytes. We're going to explain them in details. So like we already mentioned in the previous slides, what makes up the blood in our system? What is the composition of the blood we have? Blood is made up of 4 major components: the red blood cells, which is responsible for transporting oxygen; the white blood cells, which deals majorly with the immunity of our system; the platelets, which helps with blood clotting; and then the plasma. That's the yellowish aspect of the blood from this slide. Now, going down to the red blood cells, let's go ahead to describe it. What do they look like? What is their function? So red blood cells are biconcave cells. They haven't got any nucleus, and they are also known as erythrocytes. So wherever you see anybody mention erythrocytes, just know that the person is talking about red blood cells. You know, that is why there is a difference between when a medical professional is talking and when a lay person is talking. And also, when you're speaking to a crowd, you need to know their level of understanding, their profession, and then you know what terminologies to use. So if let's say as a nurse, you're giving health talk to pregnant women in the antenatal, because student nurses listening to me now, very soon, if you have not started going for your clinical postings, very soon you start going for your postings. And sometimes you'll be posted to antenatal clinics, and one of the major things you do for them is to give them health talks. So if you're talking to these women that are not professionals and you're trying to explain red blood cells and you're calling it erythrocytes, they may not understand you. But you, as student nurses, student midwives, professionals, medical professionals, if I say erythrocytes, you should know that what I mean is just red blood cells. So if you hear erythrocytes anywhere, just know that it's red blood cells. And the description of red blood cells, which we cannot see with our bare eyes until the blood is put under microscope. But I'm going to give you a slide showing the picture of red blood cells, how they apply and how they appear under the microscope. So red blood cells are biconcave cells. They don't have nucleus, and they are also known as erythrocytes. The red blood cells contain iron. There's a particular iron-rich protein called hemoglobin, and it is that hemoglobin that gives our blood the red color. The hemoglobin binds with oxygen. We'll meet that later. So the red blood cells are mostly produced in the bone marrows. So if you meet any question, maybe in your exam, your school exam, or even in your professional exam, your nursing and midwifery council exam, asking you which places are can red blood cell be produced. If you see bone marrows, please pick it. Red blood cells are mostly produced in the bone marrows. That is why those who have sickle cell disease, most times one of the treatment is bone marrow transplant, because the bone marrows they have is not functioning as it should. So if they are the ones they have is taken away and replaced with a better one, that it improves the production of the rate of production of their red blood cells, the good red blood cells, and it makes their condition better. So if you meet any question asking or saying red blood cells are produced majorly in the bone marrows, true or false, you should know that it is true. Then another function of the red blood cell is that it helps to transport oxygen, like I've already mentioned before, transporting oxygen from the lungs to the body system, and also transporting carbon dioxide from other system or other tissues and organs to back to the lungs. So because these red blood cells, they have got what we call hemoglobin. The hem part of it is the iron-rich content of the red blood cells. They bind with the oxygen and help to transport the oxygen to the body tissues and organs. So that is one of the major functions of the red blood cells. The red blood cells, like we've mentioned, they are produced in the bone marrow. Then older red blood cells, older erythrocytes, are removed from the system and they are destroyed in the liver. So, and the lifespan of the red blood cell is approximately 120 days. So if red blood cell is produced now, it stays for approximately 120 days before it is destroyed. But that is the difference between someone who doesn't have sickle cell anemia and a person who is suffering from sickle cell anemia. Because in sickle cell anemia disease, they have these red blood cells, but the state of the red blood cells is not normal. The quality of the red blood cell in a sickle cell patient is not healthy. The red blood cells, the shape is different, and it doesn't last for up to 120 days. That is why most of the times they are anemic. So going ahead to talk about the red blood cells, they are also known as erythrocytes. They transport oxygen from the lungs to the tissues, and the hemoglobin is found in the red blood cells. The hemoglobin combined with the oxygen to give oxyhemoglobin. And the dead red blood cells, that's the one that have overstayed their lifespan, they are destroyed and taken care of by the liver. So this is the diagram of the red blood cell. It's biconcave. It has some depression on the two sides. That is how the red blood cells, how they look like under the microscope. We cannot see this structure or this object the way it is, the way we're seeing it on the screen now. It is not how you're going to see it if you're looking at blood, unless it is put under a microscope. So like we've mentioned before, the major one of the major functions of blood is transportation of red blood cells, is transportation of oxygen from the lungs to the tissues, and transportation of carbon dioxide from the tissues to the lungs. So let me ask one question, because I always like my class to be for people to contribute, so that I'll know I am not talking to myself. So what did I mention that the oxygen binds to before being transported from the lungs to the tissues? Can someone either type it as a message or unmute yourself and tell me, where are the oxygen molecules bind? Where would they attach themselves before they are moved to different parts of the body? Can someone tell us? Oxygen cannot travel on its own. It cannot attach itself on its own to the red blood cells. So it must bind somewhere before it can be moved. Okay. Someone has answered it. Thank you very much, Emanuela. The oxygen cannot move on its own. No. If it moves on its own, it will not be useful to the body. That is why it must attach itself to the hemoglobin. Someone has answered it. Thank you very much. I'm just seeing a message now. Someone said, please let the recording be audio-visual. Can you explain what you mean? Because the recording is always audio and visual. The last one we sent, you see the audio, you see the visual, and then you hear the audio. So it's also going to be exactly the same way for today's lectures, okay? If there's any other thing you want to explain about that, but normally the recording will be audio and it will also be visual, because you see it, you see the slides as we explain them, and you also hear the audio. So thank you very much. We'll continue. Now, talking about figures, the normal blood contains about 13 to 15 grams of hemoglobin per 100 ml of blood. One red blood cell contains about 250 million molecules of hemoglobin. In fact, God is wonderful. Because myself, I cannot imagine 250 million molecules of hemoglobin in one single red blood cell that we cannot even see with our eyes. But that's how much hemoglobin molecules that can be contained in one single red blood cell. So each molecule of hemoglobin carries about 4 molecules of oxygen. Now, mathematicians in the house, can we now calculate how many molecules of oxygen can be contained? Hello?
Yes, ma'am, we are with you.
Okay. Can we estimate how many molecules of oxygen that can be contained in one single red blood cell from the figures here now? If one red blood cell can contain 250 million molecules of hemoglobin, and each molecule of hemoglobin contains 4 molecules of oxygen. Now estimate how many molecules of oxygen can be contained in one single red blood cell. Can someone attempt that? That's mathematics.
4 million.
How did you get that? Explain, show work.
I should show.
Yes. Explain how you got the 1 million. And if any other person has a contrary opinion, you are very free to also tell us.
Okay, well, molecules are formed by atoms. Eh?
Uh-huh.
And here they say they have 4 molecules of oxygen. That's 4 oxygen.
Uh-huh.
If one red blood cell contains 250 million
Uh-huh.
molecule of oxygen, that
Of,
means you have to multiply it by the 4
by
oxygens
4.
there.
Very good. Very good.
Yes.
So that's 4 million.
Any contrary opinion? Or we are going by what she has explained?
I think we
Yeah.
are going by what she has said.
Yes, I think she got it. See, our brain should be very sensitive to figures and mathematics. Once you are a nurse or an aspiring nurse or a midwife or any health professional at all, you must know your mathematics. You must know your figures. There's nothing like I don't like maths. Because for every shift you do, you must give medications. And most times, for you to give a particular medication, you must do some calculations. Because if you don't get your figures right, the tendency that you're going to give a wrong dose is there. Do we understand that? So we should love our figures. We should love our calculations. We'll get into drug calculation much later. We'll make it so simple and so understandable that when you see drug calculation, you will not be scared. But that will come on a later date anyway. So let's carry on. So the production of red blood cells, the production process itself is known as erythropoiesis. Now, if you hear this word or see it anywhere, you should know who is, let me mute some people, please. Okay. Now, in your exam, you may be asked to explain what the term erythropoiesis means. Or you'll be given erythropoiesis is, they will now give you different options. But after this lecture, you should know that erythropoiesis means the production of the red blood cells. Okay. The mechanism of producing of the body, our body system producing red blood cell is known as erythropoiesis. So instead of saying the method the body produces the red blood cells, you can just say erythropoiesis. So for adults, this process takes place in the bone marrows, like we have already said it before. Especially the bone at the hip, the breastbones, and the ribs. Those are the long bones where erythropoiesis mostly happens. But children up to 5 years, this process can happen in all their bones. But babies still in the womb, it is the liver and the spleen that takes care of the production of the red blood cells. Can someone give us one of the reasons why the babies in the fetus, the babies in the womb, their red blood cells are produced in the liver and spleen? What could be the reason? Can someone suggest or explain to us why?
I think because their bone are not yet formed.
Very good. Very good. before a fetus starts having strong bones, mature bones. In fact, most times when they are even delivered, their bones are still very fragile. In fact, their bones don't even look like bones. You can actually bend their bones. That means they are not matured enough to produce red blood cells. That is why nature has made it in such a way that for them, without properly developed bones, their liver and spleen now carry out this process of erythropoiesis. Now, another terminology that I want you to know tonight is what we know as, or what we call, polycythemia. And this is increase in the number of red blood cells. Sometimes, or most of the times, when someone is sick and the person goes to the hospital and tells, or goes to the lab, it is obtainable in Nigeria. People have their private labs, and anybody can walk in and say, oh, I want you to run some tests for me. Just do full blood count, do malaria, do typhoid. So one of the things that will be checked if you're going in for a full blood count is the quantity of red blood cells. So if the quantity of red blood cell is higher than it should be, it is called polycythemia. Poly means more. Wherever you see poly, it means more. So increase in the number of red blood cells in a person's system will be known as polycythemia. And decrease in the number of red blood cells will be known as erythropenia. Erythropenia. So take note of all the terminologies we've mentioned today. We've talked about erythropoiesis, which is the production of the red blood cells. We've talked about polycythemia, erythrocythemia, erythropenia being the decrease in the number of the red blood cells. Now, let's talk about the white blood cells. Can we see the screen? Those are the types of white blood cells that can be found in the blood: basophil, neutrophil, eosinophil, monocyte, and lymphocytes. Now, going to the white blood cells, it is also known as leukocytes. So if you hear somebody mention leukocytes, just know that the person is only referring to red blood cells and nothing else. So they are irregular in shape and colorless, and they have nucleus. You know, the red blood cells, they don't have nucleus, but the white blood cells, they do have nucleus. They protect the body from infections and foreign particles. They are produced in the bone marrow and destroyed in the spleen. And the lifespan is approximately 12 to 20 days. This lifespan has so many controversies. You see different figures everywhere, but just know that is within this range, 12 to 20 days. And the total number of white blood cells will be 4,000 to 11,000 cubic millimeters. And there are several types of white blood cells, just like we saw in this particular slide. And all of them have their different roles, and their major role is just to protect the body against infection, bacterial infection, viral, fungal, and other parasitic infections. So what the red blood cells do is that when they locate the source of this, when they locate the pathogen or the thing carrying the infection, the cells, they will move towards it and try to attack and destroy it. Do we get that? The white blood cells once, just like if a bacterial agent is introduced in the system, or a viral agent, or fungal agent, or any parasitic infection at all, the white blood cells will be signal, they will get that signal and they will move towards that particular object and try to destroy it, so that they will protect your system from being affected by that particular bacterial or viral or fungal agent. So what do white blood cells do in our system? These white blood cells, they help us to fight diseases in 3 different ways: by destroying the harmful bacteria, by creating antibodies against the bacteria and viruses, and by fighting malignant diseases. So the first way they can help to fight infection or to fight diseases is that they can go to that particular bacteria and then engulf it and destroy it. Alternatively, they can create what we call antibodies, and the antibodies will now be the ones to fight the bacteria or the viruses when they are introduced in our system. And the next one is they fight malignant diseases. Malignant diseases are cancerous diseases. The white blood cells help a lot. That is why there are some occasions when someone is not feeling well and the person goes to the hospital and they do the full blood count, and then the white blood cells, the number or the figures are way higher than they should be. So the first thing that will come to your mind, what I'm telling you now, is a knowledge that is going to help you all through your practice in health and medicine. Once you see full blood count, even as a student nurse, just learn this now. Use it as one of your take-homes today. Once you look at somebody's result, full blood count, and the white blood cells are high, know that there is a particular infection going on in that person's system. And the body has been signaled to fight this infection. And one of the responses from this signal is the body producing more red blood cells than it should, so that it will have, red blood cells are like soldiers. They're like military men that we have in our body. So like, let's say a country that is peaceful, no wars, no violence, nothing, there won't be any need to have more number of soldiers. There won't be any need to recruit more soldiers, because even the ones that are there, they're not doing much. But once there seems to be an uprising, just like what is going on in Kenya now, the system will be pressurized. There will be a lot of pressure on the system, and the next thing they will do is to recruit more soldiers or call some other countries to bring more soldiers for them to fight that particular incident going on. Same with war-torn areas like Ukraine and Russia. Then the number of soldiers they had before these incidences won't be enough for them. So they need to recruit more. They need to ask for more soldiers to come and help them. That is exactly what happens in our body system. So our body sends signal to the places we produce the white blood cells from. Once they see any invader, once they see any virus or bacteria or fungal infection or malignant cells, they send a signal, and if the white blood cells, if it doesn't seem to be enough, the body will be pressurized to produce more soldiers, more white blood cells to fight this infection. That is why when the person goes for test now and you look at the result, once you see white blood cells raised, just tell yourself that there is an infection going on in this system. Then it will now be, you will now focus on finding why, what the infection is, what is the cause of this infection, and then treat it. Don't just treat the symptoms. Look for what is causing those symptoms and then treat, and the person will be all right. Do we understand that explanation? Hello? Should we continue? No one is answering me. Am I talking to myself?
You are with you.
Okay.
Continue.
No,
Mommy,
we are with you.
continue.
All right. Thank you. Okay. Now, the next component of blood that we're going to explain will be the platelets. So the platelets are only about 20% of the diameter of the red blood cells. That means the platelets are a lot smaller than the red blood cells, and the most numerous cell of the body. The normal platelet count is 150,000 to 350,000 per microliter of blood. Platelets are also produced in the bone marrow and destroyed in the spleen and liver, and their lifespan is about 5 to 9 days. So the shape is like circular to circular by convex, not by concave now. And it doesn't have nucleus. Which blood cell has nucleus? Someone should answer
White blood
us.
cell.
What?
The white blood cell.
Very good. So the red blood cells, no nucleus. The platelets, no nucleus, just the white blood cells. Thank you very much for that answer. So, and the major function of the platelets is what? Blood clotting. It helps our system to clot. It helps our blood to clot when we are bleeding. So it serves as a protection for us not to bleed too much. That is why there's a particular condition called hemophilia. Hemophilia is whereby the clotting factor in the patient system is either not there or not working well. So if the person starts bleeding, if the person gets a wound and the wound starts bleeding, to control that bleeding is always very difficult. But for a normal person with normal platelets and normal clotting factors, once you start bleeding, a signal will be sent, platelets will come and form clots, and then the bleeding can stop. So now the platelets help to prevent bleeding. Platelets also originate in the bone marrow and they circulate all over our system. Their primary function is to stop bleeding. Now we've explained three types of blood cells. Red blood cells, we explained what it does. White blood cells, we explained what the white blood cells they do in our system. And the platelets are the ones we are talking about now. So at the end of this lecture, I'll expect one or two people to just summarize any of the blood cells that you can remember that we have talked about and what is their major function. So for the platelets that we're talking about now, the major function of the platelets is to help in preventing bleeding. All right. So if a blood vessel is damaged, our body will send a signal to the platelets. And cause the platelets to migrate to the injury area. The place you are injured, platelets will accumulate there. And before you know it, the bleeding will stop. Sometimes something will happen to us. We will not even know that something has happened until we now see blood clots. Oh, what happened? I was even bleeding. I didn't know. Do you get it? Or maybe you scratched something off your off your skin. You were not even aware. The next time you touch it, something is hard there. Oh, what has happened? You now see that it has bled and formed clots on its own without even you knowing it. So that is nature taking care of the bleeding at that point in time. Though some bleeding will need external help, like bandaging, suturing, and the rest of it. But some of, even when we go for surgeries, how many of us have witnessed surgeries before?
I have.
You've seen where someone is operated on before.
Yes,
I operated
How was that experience?
it
Uh,
wasn't too bad.
it wasn't too bad. Okay, what kind of surgery was that?
Okay, appendicitis, appendectomy and cesarean section.
Cesarean section. What was your feeling the first time?
It was like I was the one being operated. It felt
I almost fainted the first day. The first day I witnessed cesarean section. Literally speaking, I almost fainted because I could not imagine a human being being opened up. Then after opening up the different layers carefully, the next thing is the uterus is opened, baby is brought out. The uterus is even brought completely outside the woman's
outside, like outside the abdomen.
Yeah. And some of them bleed a lot.
Yes,
If the doctors
yes.
are not fast enough to clamp the arteries and the veins, you see blood gushing like. So
Yes,
that
from
is,
the YouTube.
yes, both from the uterus and from the other blood vessels around that has been cut. So now, once that incision is done, let's take, for example, during surgery. If that incision happens, the next thing is that the body sends signal to all the platelets. Now go to this place and take care of it. Okay? Just like in the house, if maybe the door leading to the outside of the house, you just hear it open. Maybe it wasn't properly shut, and then there was a lot of breeze and the door opens. The normal thing is anybody in the house will just go to that door to shut it, isn't it? So that is exactly what happens in our system. Once we have an incision, once we have a blood vessel that has been tampered with, and blood is escaping from there, no matter how small that blood vessel is, a signal is sent to our system to go and shut it, and shut that door, and shut that opening, so that more blood would not escape. So no matter the size of the opening, or the size of the wound, or the size of the incision, once a blood vessel has been tampered with and blood is escaping from there, a signal is sent and the platelets go straight away to shut that portal, to shut that opening, to shut and to stop the bleeding. Do we get that explanation?
Yes.
So once the platelets start arriving, when they start arriving to the site, they'll start clumping together and they form clots and they help to stop bleeding. So the production of platelets is known as thrombopoiesis. Now, when you do the full blood count for a patient, and there is increase in the number of platelets, that condition is known as thrombocytosis. But if there is decrease in the number of platelets, it is known as thrombocytopenia. Now, as students, which most of you, I know most of you are students, what helped me personally to pass my exams back then is, sometimes I might see a word or a terminology, but I don't know anything about it. The next thing I'll try to do is to break the words down. You see that if you break the word down into 2 or 3 bits, automatically you will understand what it is talking about. Cytosis always talks about when something is more than it should be. Penia always talks about when something is lower than it should be. So if you do not understand anything again tonight, please go home with what I just said. Cytosis most times is talking about increase in the number of the particular thing they're talking about. When you're talking about penia, most times it talks about the decrease in the number of that particular thing. So thrombocytosis is when the platelets are higher than they should be. Thrombocytopenia is when the platelets are lower than they should be. Then thrombopoiesis is the production of the platelets. So we've mentioned several terminologies now. I hope you're jotting them down, because those are likely exam questions, both in your nursing council exam, your midwifery council exam, your class exams. Jot them down, go through them, they will help you. Even if they don't help you directly, they might help you to answer another question that look like it. Do we get it? So just if you see any word, try to break it down. Try to break it down and then pull your understanding of the word in bits. Pull the meaning together and you get the meaning of that particular terminology, even if you haven't heard of it before. So the last part of blood will be the plasma. And this plasma is even the greater portion of blood. So if you withdraw, let's say 10 ml of blood from a patient, and there's a process called centrifuge, right? Where the test tube is spinned in a very fast motion. After spinning it for some minutes, for some seconds or for some minutes, everything will sediment. The cells will go down and then the plasma will be up. That plasma, the color is yellowish in color. And the plasma is a pale yellow colored liquid. I've already shown us the color before, right? Yes. Can you see the screen now?
Yes, ma'am.
Yeah. The upper part of this test tube is plasma. And this is when the blood has been centrifuged. It has been put in the centrifuge machine and spinned. If you have gone to the lab when they are doing this particular, they are conducting some tests, you see them putting some test tubes with blood inside the particular machine, and then when they on it, it should start spinning and making some sound. That is the way they estimate the blood cells, the quantity of blood cells in the system, if it's high or low. So after spinning the blood, that is what you get. The blood particles will go down and the plasma will stay up. And from this slide, you see that blood is now divided into two, the cellular element and the plasma. The plasma is even 55%. The volume of plasma is higher than the other components of blood. Okay, let's talk about the plasma now. The plasma is a fluid made of water. 92%, about 92% of the plasma is just ordinary water, just water. And other components found in the plasma includes proteins, the bulk of which are manufactured in the liver. And you can find the albumins, the globulins, the fibrinogens. It is the fibrinogen that is the major factor that helps with blood clotting. Okay.
Okay.
So, function of the plasma, the constituents. The first and most, the major constituent of the plasma is water. And it helps in absorption and transportation of nutrients and heat to different parts of the body. The albumins, also found in the plasma, helps in osmotic balance. The globulin helps in defense mechanisms. The fibrinogen helps with the blood clotting. And electrolytic ions.
Yes.
You know, in our body system, we have different ions floating around. We have sodium, we have calcium, we have magnesium, we have iron, we have so many of them. So those ions are mostly located in the plasma. The plasma is the most conducive place for them to work. So they also help in pH. We have already mentioned the pH of blood to be what? 7 point what?
Oh. It's slightly alkaline.
Yes, and approximately what pH?
7.4.
Very good. So that's the blood being acidic or alkaline. What determines it is also these electrolytes. You know, the positives and the negatives, and it can make it acidic or alkaline. So the pH buffering of the blood is the major thing that takes care of it or determines it is the plasma. So now, before we go to anemia, I would like us to, just one person each, the 4 components of blood that we have mentioned, just one person should tell us one component and the major function of that component of blood. Unmute yourself and talk. You don't need to on your video.
Okay.
Amarachi, do you want to tell us something? We've talked about the 4 components of blood. Tell us one and the major function.
Okay. Well, I'll talk about the red blood cells.
Okay.
Okay. The red blood cells are one of the cellular elements of the blood.
Mhm.
And also, they are the cells that are mostly involved in the transportation of oxygen and carbon dioxide.
Okay. Okay.
And they are mainly in charge for the red color of our blood.
Okay.
That's the red blood cells. And they contain hemoglobin, which are rich in protein.
Rich in what?
Protein now.
Protein. Okay. Okay.
Okay. So these red blood cells are produced in the bone marrow.
Okay.
Okay. And they have a lifespan of 120 days.
Very good.
Okay. So these red blood cells, like the production of this blood cells is known as erythropoiesis.
Mm-hmm.
So in adults, the production of these red blood cells takes place in the long bone marrow.
Mm-hmm.
That's the breastbone and the hip bone.
Mm-hmm.
So this hemoglobin,
Red blood cell.
oxygen cannot go around the body on its own. So it has to join with hemoglobin, which forms oxyhemoglobin.
Mm-hmm. Okay.
That's it for that
You
one.
done. Thank you very much. In fact, I'm so excited. You know, I'm convinced I have not been speaking to myself all this while. So thank you very much for that wonderful explanation. Thank you very much. The way you have explained it now, I don't think you ever forget it. You know, like I have already said before, the questions might not come exactly the way I have explained it, but because you have understood it, no matter how they twist the questions, you should be able to pick the correct answer. Okay, that is one of the reasons it's very good to stay in this class. So it is not good to only wait for the recorded video, because as we are asking you questions now and you are answering them, it is registering more in your mind. If you have questions, you'll be able to ask and you get your answers live. So it is never the same with when you listen to the recorded videos or audios. So I'm glad someone has really understood one of the things we talked about now. So Emanuela has explained to us red blood cells, and we talked about 4 major components of blood. So can someone now talk about the next one? Just
I'll
pick
talk
any
about
other one. Okay.
now talk about the platelets. So
Okay.
its lifespan is 5 to 9 days.
Mhm.
Its function is it helps for blood clotting,
Okay.
and it's cellular biconvex in shape.
Mhm.
So the production of platelets is called thrombopoiesis,
Mhm.
and the increase in the production is called thrombocytosis.
Side.
And the decrease is
Mhm.
cytosis. Did I get it correct?
Yeah.
And the decrease is called thrombocytopenia.
Topenia. Very good.
Yes.
Very good. Very good. Thank you very much for that wonderful summary of that topic. So we've explained 2 now. So someone should take the next one. We've got white blood cell and plasma. Someone should talk about white blood cell or plasma. Tell us, just summarize in few sentences what you understood from this lecture. If you have talked before and you want to talk again, you are free to go ahead.
The plasma is the watery components of the blood.
Okay.
Yes. It's found maybe during centrifuge. Okay, if the blood is being centrifuged,
Very good.
the liquid part that comes out from the blood is the blood plasma.
Mhm.
And it has four components or four types.
Mhm.
So it has the protein, which is manufactured in the liver. the albumin, which maintains osmotic pressure, osmotic balance. It's for osmotic balance. Then
Okay.
the fibrinous
Fibrinogen.
fibrinogen is it's mainly for blood clotting. So the globulins, and I didn't really get that one. I think
Okay.
that's the one I remember.
Globulins help with the
Okay.
defense mechanism.
Defense mechanism. Okay.
That means it's supporting the white blood cells, right?
Yes.
Okay. All right. That's very good. Thank you. Thank you for that wonderful explanation. Then we're left with the white blood cells. The white blood cells are our soldiers, though. And you people have not picked it first. Let them not be
Okay.
angry with you tonight.
I'm going to talk of the white blood cells.
Very good. Please, you need to.
Well, we have, under the white, they have types of white blood cells, the basophils, the neutrophils, the, what's the name again, sir? The,
eosinophils. Okay, just continue.
eosinophils. Okay, basophils, neutrophils, is it, I not get it very well when they mentioned
Just
it.
carry on.
So they are responsible for the that's immune defense.
Very good.
So they create antibodies, like they create antibodies that protect bacteria and virus in our body. So we have 4,000 white blood cells in our body, and they are produced in the bone marrow and destroyed in the spleen. Well, bone marrow, the production of bone marrow is known as leukapheresis. So that's that one for bone marrow, white blood cells.
Okay. Leukapheresis. And when there is increase in white blood cell, I explained something that if a patient goes to do the full blood count test, and maybe it could happen it could be your brother or your sister, once you have entered School of Nursing or the university to read nursing, you have become a professional medical doctor and a professional nurse. That's just the truth. Everybody will be calling you for one problem or the other. So there are some basic information you need to be accustomed with. So I explained something that if someone goes for full blood count and white blood cell is increased, which is the leukocytosis, what could be the cause?
Okay, it's
someone can talk. Just talk.
You said when the white blood cell increases during a test, it means that there is an infection in the body. So the body will now send message to the am I mistaken? That is no. It's when the white blood cell increases, like that means there's an infection. So we should not only treat the signs and symptoms, we should treat the infection.
We should look for what is causing that infection, because we explained that there are ways the white blood cells fight infection. The first one is engulfing the bacteria or the virus or the fungus. Then the next one is by creating antibodies that will fight those foreign bodies in our system. The third one is by fighting malignant diseases. That's cancerous cells it is also the white blood cells that go to fight them. So if a signal is sent that we need more white blood cells because an infection is going on, that means the body needs more soldiers. The body will start producing more white blood cells to tackle that particular infection. So let's just talk about anemia. Just let's summarize what anemia is, because anemia is a very massive topic on its own. We know that, right? So we can take anemia as a topic on a different day, but let's just talk about, in summary, what anemia is. So one of the commonest blood disorder is anemia. Anemia is when it could be decrease in the number of red blood cells. It could be that's blood loss, excessive blood loss can lead to anemia. Excessive destruction of blood cells can also lead to anemia. Deficient red blood cell production can lead to anemia. And low number of hemoglobin in the red blood cell can also be known as anemia. And also when the blood doesn't have enough oxygen, that means the red blood cells are not functioning at their full capacity. You know, we said there is about 250 million molecules of hemoglobin in a single red blood cells. That was what we mentioned before, right? So if we don't have enough oxygen attached to the red blood cells, that means the red blood cells are not functioning to their full capacity. And our body system will see it also as anemia. So these are the different forms that anemia can present. So I'm promising us that we're going to talk about anemia. We are going to explain anemia in details, different types of anemia. That is why some people will have, you know, what was the estimated quantity of blood that we mentioned today that we can find in males and in females. For the males is higher, for the females is lower. Now, the quantity of blood a patient can have may be normal. Quantity of blood is normal. But the quantity of blood cells will be reduced. It is also known as anemia. Then the quantity of blood cells may be normal, but the volume of blood is reduced. It is also known as anemia. So I'm going to explain all this in details. I will also give you the conditions, the various health conditions, disease conditions that can present with hypovolemic anemia and normal volemic anemia and the rest of it. We'll explain different conditions of anemia and give examples of these conditions. All right. So there's no time now. I would have talked about ABO and rhesus blood group systems, but that would be a topic for another day. With this, I thank you very much for participating actively in this class. I believe you haven't wasted your time, and I haven't wasted my time too. So by the special grace of God, we're going to continue at least having these lectures once a week, at least once a week by God's grace. That is my target. And okay, before I go ahead, if you have any question, you can ask now. Any question?
I don't have any more.
Message from Courage. God bless you too. Okay, in the absence of any question, so we have come to the end of this lecture tonight. Like I said, at least once a week, we'll meet like this, talk about very important topics that will be beneficial to your passing your exam and also your practice in the future or your current practice in patient care. So like I mentioned in the last class, what we do is to support students to become the best they can, to pass their exams. You don't wait until you fail before you come to us. Even your assignments, even your presentations. I know what I personally struggled with as a student. It's not easy coming out in the front of the class to present a topic. It's not that there are cases we are dealing with now. Some students were given topics, seminar topics. They don't even know how to arrange their table of contents, not to talk of starting the work itself. So that is what we're going to also help you to do. We'll help you craft a very beautiful table of content, help you, show you how to write it, help you to become a better version of yourself, help you to become a better professional in the future. Even if you're a nurse already, just come to us with your challenge. We'll try our best to put you through. So with this, we are ending tonight's session. Thank you very much, and may God bless you. If you have any question, if you have any contribution, if you have anything to say, put it up on the group. As soon as I see it, I will attend to it. Bye-bye, and have a good night rest.
Okay, thank you, ma. Good night.
Good night. Bye-bye.